The wrist is a complex joint that serves as the bridge connecting the forearm and the hand together. It consists of a main radiocarpal joint between the radius and the proximal row of the carpal bones minus the pisiform, and the smaller intercarpal joints, which are small joints among the carpals. Then we have the hand, which consists of the carpometacarpal joints, the intermetacarpal joints, the metacarpophalangeal joints, and the interphalangeal joints. Try saying those 3 times fast. Okay, let's start with the wrist joint. First, there's the radiocarpal joint, which is a condyloid type of synovial joint consisting of the distal radius and scaphoid, the lunate, and the triquetrum carpal bones. Interestingly enough, the ulna doesn't participate in the radiocarpal joint. It is the articulating surface of the distal radius and the articular disc of the distal radioulnar joint, which articulate with the proximal row of carpal bones to form the radiocarpal joint. The articulating surfaces of the radiocarpal joint are surrounded by the tough joint capsule and synovial membrane, extending from the distal ends of the radius and ulna to the scaphoid, the lunate, and the triquetrum. The joint capsule of the radiocarpal joint is reinforced by a couple of ligaments, both on the dorsal and the palmar sides of the joint. The palmar ligaments extend from the distal radius to the 2 rows of the carpal bones. These ligaments strengthen the joint and make it possible for the hand and the radius to move as one unit during supination of the forearm, or turning the palm upwards. To remember this, think about cupping both your hands and bringing them together to hold a bowl of soup, which mimics the movement of supination. On the posterior side of the radiocarpal joint, there are the dorsal radiocarpal ligaments, which also extend from the distal radius to the carpal bones. These ligaments stabilize the wrist joint and ensure that the hand follows the radius during pronation of the forearm or the turning of the palm downwards. Other ligaments that strengthen the radiocarpal joint are the ulnar collateral ligament on the medial side, which extends from the ulnar styloid process to the triquetrum, and the radial collateral ligament on the lateral side, extending from the radial styloid process to the scaphoid bone. Now, a couple of muscles act on the radiocarpal joint. They're easy to remember because they all attach to the carpals distally and they have carpi in their names. So, there's the flexor carpi radialis and the flexor carpi ulnaris, which flex the wrist, the extensor carpi radialis longus, the extensor carpi radialis brevis, and the extensor carpi ulnaris, which extend the wrist, the abductor pollicis longus, the flexor carpi radialis, the extensor carpi radialis longus, and the extensor carpi radialis brevis, which abduct or radially deviate the wrist, and then finally, the extensor carpi ulnaris and the flexor carpi ulnaris muscles, which adduct or ulnar deviate the wrist. Now the radiocarpal joint receives its blood supply from the dorsal and palmar carpal arches, originating from the radial and ulnar arteries. Regarding innervation, remember Hilton's law, which says the nerves that innervate the muscles crossing over a particular joint also innervate that joint. So according to Hilton's law, the radiocarpal joint is innervated by branches of the median, ulnar, and radial nerve. Now let's look at the intercarpal joints, which are the small joints between the carpal bones. They can be put into 4 groups to make things simple. There are joints between the carpal bones of the proximal row, the joints between the carpal bones of the distal row, the mid-carpal joint between the proximal and distal rows of carpal bones, and the pisotriquetral joint located between the pisiform and the palmar surface of the triquetrum. All of these joints are the plane type of synovial joint limited to the gliding movements between the carpals. Though this sounds like a minor role, these joints are important because their combined little movements augment the range of motion of the radiocarpal joint. Sometimes less is more. Now, after the distal row of carpal bones, there are the long metacarpals, which form carpometacarpal joints with the carpals and intermetacarpal joints among themselves. The first carpometacarpal joint is responsible for the movements of the thumb and consists of the trapezium and the first metacarpal bone, which is the only saddle type of synovial joint of the carpometacarpal joints. The other 4 carpometacarpal joints are plane type synovial joints formed by the articulations between metacarpals 2 through 5 and the distal row of the carpal bones. The thumb's carpometacarpal joint is a much more mobile joint, so it allows for flexion and extension, abduction and adduction, and circumduction. It also allows for some axial rotation, which is essential to the movement of thumb opposition. Distal to the metacarpals, there are the phalanges, which are the bones of the fingers. All the fingers except for the thumb have 3 phalanges, a proximal, middle, and distal one, while the thumb only has a proximal and distal phalange. The phalanges form metacarpal phalangeal joints between them and the metacarpals, and interphalangeal joints between the proximal phalanges and the middle or distal phalanges. They also inspired a certain Friends character to change her name to Regina Phalange. Bonus points if you can remember who that was. Okay, now on a more serious note, in the metacarpal phalangeal joints, which are the condyloid type of synovial joint, the heads of the metacarpals articulate with the bases of the proximal phalanges, and there are synovial membranes surrounded by a joint capsule for each joint. The metacarpal phalangeal joints permit adduction and abduction movements, like when spreading your fingers apart to make a peace sign, and also flexion and extension, which happens when you clench and unclench your fingers at the level of the knuckles. The interphalangeal joints, on the other hand, are the hinge type of synovial joint, so they only allow for flexion and extension, like when you're signaling someone to come over with your index finger. Now there are 3 important muscles that flex the metacarpal phalangeal and interphalangeal joints. First, there is the flexor digitorum superficialis, which flexes the proximal and the middle phalanges at the metacarpal phalangeal and proximal interphalangeal joints of the medial 4 digits due to its tendon insertions on the shafts of the middle phalanges. The flexion of the distal phalanges at the distal interphalangeal joint of the medial 4 digits is done by the flexor digitorum profundus due to its tendon insertions on the base of the distal phalanges. Both the proximal and distal phalanges of the thumb are flexed by the flexor pollicis longus, acting on both the metacarpal phalangeal and the interphalangeal joints. Just one pause because we hit the recap. Can you name the bones involved in the radiocarpal joint? Alright, as a quick recap, the wrist joint connects the hand to the forearm. It is a condyloid type of synovial joint located between the distal end of the radius and the proximal row of the carpal bones except for the pisiform. It can perform flexion, extension, abduction, and adduction. The intercarpal joints are all the plane type of synovial joints limited to only gliding movements between the carpals. Distal to the carpals, there are the carpometacarpal joints connecting the metacarpals to the distal row of the carpals. They are all the plane type of synovial joint except the first carpometacarpal joint, also known as the thumb, which is a saddle type. Only the first carpometacarpal joint is a mobile joint, allowing for flexion and extension, abduction and adduction, circumduction and axial rotation to allow opposition. Metacarpals connect to each other via intermetacarpal joints and to the row of the proximal phalanges via the metacarpal phalangeal joints. The metacarpal phalangeal joints are the condyloid type of synovial joints, and they allow for adduction and abduction, as well as flexion and extension. Finally, the interphalangeal joints connect the phalanges together. In the medial 4 digits, there are 2 rows of interphalangeal joints, while in the thumb, there's only 1. Interphalangeal joints are a hinge type of synovial joint, allowing only for flexion and extension.